Dear colleagues, dear chairman, my name is Ameli. I'm resident at the Department of Urology in Clinic of Korneuburg in Austria. In the next couple of minutes, I would like to present you our experiences with the sling. This is a single-center study with a mean follow-up time of 10 years. I have no conflict of interest to report. Between 2005 and 2020, the sling was indicated in 122 men with moderate to severe stress urinary incontinence. The device was not indicated in men with mild incontinence. The sling was progressively adjusted by tensioning the columns through the washer to achieve the desired retrograde liquid pressure. Specific emphasis was put on correct adjustment intraoperatively. The baseline characteristics of our patients are shown below. As you can see, we included the data of patients with one or more previous incontinence surgeries, also patients with history of pelvic irradiation. Only 46% of the patients in this cohort were index patients. 7 patients were lost to follow-up, so we evaluate the data of 115 men in a mean follow-up time of 95 months. The results? 65% of the patients were socially dry. The definition of success in this cohort was an improvement of more than 50% in PET per day usage, so the success rate was reported as 77%. We achieved the high satisfaction rate. In total, 53 adjustments were needed to achieve these results. Only in one case, loosening of the sling was required because of post-operative urinary retention. Post-operative complications include hematoma and pain. Within the whole series, 12 intraoperative bladder perforations occurred. In all cases, the needle was simply repositioned and the catheter left in situ for 5 days. Urinary retention was reported in 15 cases. The treatment of the retention was placing a catheter for 5 to 10 days. Only in one case, as I mentioned before, loosening of the sling was required. In total, 46 revisions were performed in a mean follow-up time of 54 months. In this table, you can see the most common reasons of revision. The revision-free rate in this cohort was, after a follow-up time of 5 years, 78%. Most of the revisions were explantations, 39 out of 46, and the explantation-free survival after a follow-up time of 5 years was 77%. The most common reason of explantation was insufficient continence recovery, followed by erosion and some cases of infection and device dislocation. I mentioned the explantation-free survival rate in the last slide, and you can see the time to explantation in detail below. In this cohort, the explantation-free survival was 84% after 3 years and 77% after 5 years. It's also important to mention that most of the patients received easily a successful treatment for incontinence after sling explantation. Conclusion and take-home messages. In this cohort of 115 men with moderate to severe stress urinary incontinence, a success rate of 77% was reported. As I mentioned before, we did not indicate this sling in men with mild incontinence. The satisfaction rate was high with 96%. The explantation-free rate after 5 years was reported with 77%. Correct intraoperative adjustment prevents erosion and is crucial to achieve sufficient results. Readjustments are minimally invasive and can be done in local anesthesia. sling is an effective treatment option to achieve long-term improvement of continence in patients with moderate to severe stress urinary incontinence. Thank you for your attention and don't hesitate to send us your questions.